Today, we will be explaining a lump examination procedure. To begin, the clinician should ensure that the setting provides adequate privacy and lighting, and that the patient is positioned comfortably either seated or lying down according to the side of the lump. Next up, wash your hands with soap and water. Then, introduce yourself to your patient and gain consent.
Good morning, this is Sumit Pala. I am a fourth year medical student. I am going to examine the lump. Is that okay? While I am doing this examination, if there is any pain or discomfort, please let me know.
Begin by inspecting the lump. Visually assess the area of the lump, noting its exact site, size, shape, extent, number, color, surface, and any visible pulsations. Next, proceed to palpation. Using a measuring tape, assess the size of the lump, which may include length, width, and depth. When considering the size of lumps, small lumps are considered to be usually less than 2 centimeters in size. The most commonest causes for small lumps are epidermoid sebaceous cysts, lipomas, lymph nodes, dermoid cysts, neurofibromas, skin tags, and skin warts. Red flags to consider among small lumps are rapid growth, fixation, and any overlying skin changes. Medium lumps are approximately 2 to 5 centimeters in size. The most commonest causes are mature lipomas, enlarged lymph nodes, ganglionic cysts, abscesses, fibromas, or fibroadenomas. Red flags to consider amongst medium-sized lumps are non-tenderness, fixation, hard lesions, and other symptomatic symptoms. Large lumps are considered to be greater than 5 centimeters in size. The most commonest causes are large lipomas, sarcomas, advanced lymphomas, metastatic lymphadenopathies, large abscesses, hematomas, and red flags to consider amongst large lumps are rapid growth, ulceration, weight loss, pain, and any systemic signs. Then, assess the temperature over the lump using the back of your hand, comparing it to the surrounding skin. Differential diagnosis of lumps by temperature. When considering warm and hot lumps, they are suggestive of inflammation or infection. The likely causes are abscesses, cellulitis with induration, infected cysts, lymphadenitis, carbuncles or furuncles. Cold, cool lumps are suggestive of chronic or neoplastic conditions. Likely causes are lipomas, fibromas, sebaceous cysts, benign tumors, malignant tumors, and tuberculous lymphadenitis. Using the pads of your fingers, gently palpate the lump while looking at the patient's face for any tenderness. Carefully examine its surface, noting its consistency and margins. When considering tender versus non-tender lumps, tenderness associated with warmth and redness will most likely indicate an inflammatory or infectious cause. A lump that is non-tender and firm or fixed indicates a possible malignancy. A lump that is non-tender and soft or is mobile is indicative of a benign cause. Assess for mobility by gently moving the lump between your fingers to determine whether it's fixed to underlying structures or freely mobile. Skin-attached versus muscle-attached lumps help localize the lump's anatomical origin. Skin-attached lumps move with the skin and may feel superficial or dermal. They usually arise from the epidermis or dermis. Causes include epidermoid sebaceous cysts, dermoid cysts, skin tags or papillomas, basal cell or squamous cell carcinomas, melanomas, and infected hair follicles. The test used is by pinching the skin around the lump. If it moves with the skin, the lump is skin-attached. Muscle-attached lumps are deep and move with the muscle contractions. They are fixed to or originate from deep soft tissue, fascia, or muscle. Common causes are intramuscular lipomas, soft tissue sarcomas, fibromas, and muscle herniations. A test that is done to confirm a muscle-attached lump is that the patient is asked to contract the muscle underneath the lump. If it becomes more prominent or move, it is likely a muscle attached. To assess fluctuation, use the thumb and index finger of one hand to feel at least 2 areas of the lump while simultaneously applying pressure to the center with the index finger of the other hand. A fluctuant swelling should undergo a transillumination test, preferably in a dark room or by using a rolled black sheet of paper. Transilluminating versus non-transilluminating lumps help assess whether a lump is fluid-filled, cystic, or solid in nature. When considering transilluminating lumps, these lumps glow or allow light to pass through. Causes include epidermoid cysts, ganglionic cysts, hydrocele in the scrotum, spermatoceles, meningocele in infants, and simple breast cysts. In non-transilluminating lumps, they do not glow. Causes include lipomas, fibromas, malignant tumors, lymph nodes, reactive or malignant, and infected cysts or abscesses. Some additional tests can be done on clinical suspicion include reducibility, compressibility, cough impulse, and pulsatility. Do not forget to assess the regional lymphatic drainage areas, usually the cervical nodes for head and neck lumps, the axillary nodes for upper limb or breast lesions, and inguinal nodes for lower limb or perineal swellings. Once the examination is complete, don't forget to thank the patient and document your findings.
Thank you very much.